Hi, I'm Tammy Kasparian, and I'm here today to talk to you about hypertension. I'm going to talk to you about the definition of hypertension, the causes of hypertension, the treatment of hypertension, and the outcome of hypertension. Hypertension is also known as a silent killer. Hypertension or high blood pressure is diagnosed when the normal pressures inside the heart are elevated. Hypertension is a medical disease that can be treated with several different methods, including lifestyle changes and medication. As many as 60 million Americans suffer from hypertension, and many of those people don't even know that they have hypertension. Hypertension, untreated hypertension, can eventually lead to heart disease, kidney damage, damage to one's eyesight, and even death. That's why it's so important to learn about hypertension and to treat it. When you're diagnosed with hypertension, it is important that you follow the directions that your healthcare provider gives you. It is imperative that the pressures in the heart are maintained at healthy levels to prevent heart disease. Heart disease is the leading cause of women in the United States. Okay, that's the definition of hypertension. Does anyone have any questions? Okay, now we'll move along to the causes of hypertension. There's several different causes of hypertension. There's factors that cannot be changed, factors that can be changed. First, we'll discuss the factors that cannot be changed. One of the factors is age. As we get older, we're more likely to develop hypertension. Race. African Americans tend to develop hypertension more so than any other race. Heredity. Heredity plays a big part in hypertension. Heredity is a factor that cannot be changed. The history of your family could decide whether or not you develop hypertension. And one last factor that cannot be changed is gender. Men tend to develop hypertension more than women. Okay, that's the factors that cannot be changed. The factors that can be changed include obesity, lack of physical activity, and the amount of your sodium intake. Those are the causes of hypertension. Does anyone have any questions about the causes of hypertension?
I do have a question. How does heredity play a part in hypertension?
Hypertension tends to run in families, especially when there's a maternal and paternal factor that appears. You're way more likely to develop hypertension if both your mother and your father have hypertension. Any more questions? We'll move right along to the treatments of hypertension. The treatments of hypertension include diet, exercise, and medications. Diet and exercise are part of treatment. Medication will also be needed. If you have hypertension and you have a factor that can be changed, such as obesity, diet and exercise will be part of your treatment, along with medication, until you make those lifestyle changes. With those lifestyle changes, you may be able to get off your medication and not have to take blood pressure medicine. Medication is also another treatment. Medication will be used in cases where there's factors that cannot be changed, like age, heredity, gender, race. Those, more than likely, you will be on medication for the rest of your life to help control your high blood pressure. There are several different types of medications that your healthcare provider may use: diuretics, beta blockers, calcium channel blockers, alpha blockers. Each one of these has its specific use, and your healthcare provider will know which one is best for you. That concludes treatments. Does anyone have any questions about the treatment of hypertension? Okay, we'll move right along to the outcome of hypertension. Follow-up care is necessary in the management of hypertension. Follow-up care should include regular visits to your healthcare provider. Blood pressure monitoring should be continued even at home with an easy-to-use monitor that you can purchase from a pharmacy. By keeping track of your blood pressure, you will notice any significant changes and can let your healthcare provider know. Chances are, unless you make dramatic lifestyle changes, you will need to take blood pressure medicine for the rest of your life. Your outcome or prognosis is usually good as long as healthy blood pressures are maintained. That concludes the outcome. Now I will conclude my presentation by saying that hypertension is a medical disease that can be treated with several different methods, including lifestyle changes and medication. Untreated hypertension can lead to heart disease and death. Regular blood pressure monitoring can save one's life. It is important to manage high blood pressure by taking medications or making lifestyle changes such as weight loss, exercise, and low sodium intake. Regular follow-up visits with your healthcare provider is also recommended. Your outcome or prognosis will be much better when you maintain healthy blood pressure measurements. Thank you. Does anyone have any questions about hypertension?
I have one last question. Why is follow-up care so important?
Regular blood pressure checks are recommended to make sure your blood pressure remains in the normal range. If your blood pressures are not remaining in a normal range, your healthcare provider may need to adjust your medications. Therefore, it's important for you to make regular follow-up visits and monitor your blood pressure. Any other questions about hypertension? Thank you.